Hi, I'm Frances, and this video is for Chamberlain University, class 548, psychiatric interview.
My name is Pedro Lucas Diaz, and I consent to this video being used for the Chamberlain College of Nursing Education.
Hi, Pedro. Thank you for being here. To start, I would like to ask you some basic information. Could you please tell me your full name?
Pedro Lucas Diaz.
And how old are you, Pedro?
18.
And how do you identify yourself in terms of gender?
I was born a male and I still am
Okay. Do you identify with yourself with any particular race?
now. My family came from Brazil, but I was born in America, but I'd say, I guess, Latino.
Okay.
But I don't necessarily.
Okay. Are you currently in a relationship or married?
No, I don't think I'd be able to get the affection for that right now.
Okay. And what do you do for work or school?
I'm in college right now, and I'm currently looking for work.
That's great. That's great. And who do you live with at home?
I live with my mother and my two sisters and my uncle and cousin.
Okay. And what brought you in today? What are your concerns?
I've had issues regarding anxiety, being overwhelmed, just struggle with change, and sometimes isolation.
Okay. And I'm going to ask you some basic informations. Do you have any allergies? Environmental, medical, medications, food allergies? No. And what concerns or difficulties? Well, you just said that you were here today because of some anxiety. Is that correct?
Yes.
Okay.
Similar.
Okay. When did the symptoms start?
Probably started about 5-ish years ago, near the start of my high school and near the start of quarantine.
Okay. Okay. And how long have the symptoms lasted, would you say?
I guess they still around in some capacity.
Okay. And on a scale of 1 to 10, how severe are your symptoms?
I don't think I can say, because I think I'd be more biased to give a lower answer.
Okay. Can you describe how the symptoms feel?
I'd say whenever sudden change or something major happens, I get very overwhelmed and I tend to shut down.
Okay. And what makes the symptoms worse?
Just anything that's too much for me, I'd say. If I'm overwhelmed, I tend to just lock down, isolate, and not want to do anything.
Okay. Yeah, it's very hard. I can see how that can be a struggle at your age and trying to, figure it out, things about school and work. That can be really overwhelming. And how the symptoms affect your school, relationships, just overall life.
Well, if I get too overwhelmed or stressed, like it could be something small, like an argument, I could get very angry, or I could just go very silent. It varies.
And do you take any medications?
I take Adderall.
Okay. Any over-the-counter medications?
Occasional Tylenol, if I ever had it.
Okay. And have you been diagnosed with any mental condition in the past?
ADHD and minor depression.
Okay. Any past hospitalizations?
No.
No. Have you had any previous therapy or counseling?
One time 5 years ago, and haven't had any since.
Okay. And have you taken any psychiatric meds before?
If Adderall counts, then yes.
Okay. And who prescribed that? And does it help?
I think it's a pediatrician. It's to help me focus.
Okay. And does it help?
Yes, it does.
That's great. And have you ever had or have any thoughts of harming yourself or others?
In the past, I have had them, a while back. Um, and I used when like if I got angry or you know like stuff like that, I would want to take my anger out on something or someone, but I never did. Um, but yeah, I bite my hand if I get too overwhelmed, try and
Okay.
give myself a different sensation.
And what coping skills did you use at the time to not pursue your thoughts of harming yourself? What did you do? Because you were not on medications, right?
No, I was not.
Okay.
I guess I just kind of coped with it somehow. I just fought through it,
No.
which
Okay.
probably wasn't the best choice.
Okay. And would you say you are at a better spot today? You know,
Yeah,
than
I'd say so.
before. That's great. And any chronic conditions, hospitalizations, surgeries,
No.
like medical conditions like diabetes, hypertension.
Pre-diabetic.
Okay. And what's your education level?
I'm in college and I got my high school diploma.
Okay. And so you said you are not employed, but you are seeking employment at the moment.
Yes, I've applied
Okay.
to.
And your living situation, you said you live with your mom, sister, and some of close family.
Yes.
And do you get along with them? Is it? Do you feel safe at home?
I feel safe at home, but I cannot lie, I do argue.
Okay. Okay. Do you have close family and friends that you can talk to?
Yes, the same family I live with, and I have made more friends over the years as they've gotten better.
That's good. And do you drink alcohol or have any history of substance abuse?
If I'm out of country, I occasionally drink if it's in the legal age requirement, but that's about it. And smoke or anything.
Okay. Did you ever face any legal issues because of behaviors? No. And in terms of your body system, do you feel any fatigue, weakness, fever, weight change, skin issues, rashes, vision changes, ear pain, tinnitus, sinus issues, respiratory issues, cough, shortness of breath?
I'd say I get a little fatigued every now and then. I have a ring in my ear occasionally.
Okay. And wheezing, chest pain, palpitations, nausea, vomiting, diarrhea, abdominal pain, urinary frequency or incontinence, headaches, dizziness, numbness, tingling, increased thirst, heat or cold intolerance.
Just an occasional headache, palpitation, I guess, if I take my Adderall, just because it's increased heart rate.
Okay. With the pre-diabetes, do you feel any thirst?
Not really, only when I take my Adderall.
Oh, okay. So you think the thirst is the side effect of Adderall?
Possibly.
And how would you describe your mood today?
Pretty alright.
Okay. So the plan, I would say, is, we continue the Adderall. I think it's doing a good job. It's going to help you focus. You continue with that. We are going to, I want to see you in the next 2 weeks. I want you to book an appointment and we will discuss if you need any anxiety or antidepressant medication. I would highly recommend you to go back to therapy. That's a great tool to help with anxiety, past traumatic events. And in the next visit, I want to do some screening tools with you to see how the depression is. But I want to make sure you call at any time if you feel like you need help. And some life changes like exercising is great, going out, talking to friends, eating healthy. Those are all things that can help with your mental status. And thank you very much for participating in this interview, and I look forward to see you again.
Thank you.
thank